next slide, I think, is just our faces. So we
Yeah.
can skip through that one. You've met us. I'm Colleen. Um, we're going to start off a little bit here with some facts just to kind of give a broad overview and to kind of level set where we are in the sphere of gun violence. And if you look, we lose more than 100 people a day are killed, but 320 are at least wounded or shot. That's pretty much one every 11 minutes. So, while we've been on this call, we're coming up almost on that number right now. And what a lot of people are surprised about is when you think of gun violence, you think of mass shootings, you think of homicides, you forget that suicide is actually a factor here. And so about 60% of all gun deaths or firearm deaths are suicides. And so a lot of people don't realize that a simple step of keeping your gun secure, a simple step of keeping your gun out of the hands of someone who's in crisis can save their life. And then if you look, you're going to see about 30% of gun owners store all their firearms locked and unloaded. And so as part of the campaign that I'm with Brady, it's all about secure storage. And, and we'll get into this in a little bit though. But I need that one gun for protection. I need that one gun by my bed or by my doorstep to make sure that my home is secure. But what we're going to find out is that you're more likely to be harmed by that gun than you are to protect your house. And a good case that just came up, not good, that's the wrong term, but in California, the American Idol producers, I don't know if you remember, two of them, they were killed. There was an intruder in her home. It came out, I think, yesterday or today that it was actually the homeowner's gun that they used, and they ended up taking their life. And so, again, like keeping it simple in a lock with a key can save so many more lives. What does, a safe gun in your home or having a gun in your home? It's suicide, which we've talked about, unintentional shootings, right? Children are curious. They're going to explore. They're going to get into a gun in the home. They're going to find it. We lose 8 children a day to finding an unsecured gun in the home. And actually, with End Family Fire, a couple of weeks ago, we got a call from a dad. He was a police officer in Louisiana. And he said, I'm going through divorce, or I was then. I wasn't supposed to have my son. And so my son came over. I wasn't even paying attention. He was 3 years old. And I had put my gun under the bed, not thinking about it. And the 3-year-old found the gun and put the gun to his head. And, his son was killed. And so he lives with that every single day. And he said, I should have just done that one time. I should have just always kept it locked. We also can get into gun theft. A lot of times from the home, someone's in the home, they see the gun, they can take it from cars. A lot of times people aren't locking their cars, it's in there. And we have a number of guns that are just disappearing and then used, which we can talk about. Brady has a whole crime guns that can tell you about time to crime and what happens when a gun is stolen. Now, here's where it's interesting. Access to a firearm triples the risk of death by suicide. Because what you'll see, and I come from the suicide space, it's, if someone's in crisis, that is easy access to that firearm. And there's a misperception they're just going to use another method. It's not the case, right? And even if they were other lethal means, they at least have a fighting chance to survive. With a gun, there's a 90% chance they won't survive. And so, that access to a gun in someone in crisis, if you kind of limit their access at that time, you can save their life. Now, if you look, the numbers in 2023, the latest data that just came out, because there is a lag time for compiling national data and stats, we lose someone from firearm suicide every 19 minutes. And now, what does that look like for the year? That's 27,300 people that we lose just by firearm suicide. And so this is the highest number we've ever seen. We're trending the wrong way, and which we'll see in a little bit. Some of our frameworks for addressing it are being dismantled. So, it's all hands on deck at this point, and really making sure that someone in crisis does not have access to that gun.
And making sure everyone can hear me, sorry. So, and to kind of dive in on Pennsylvania, I know not everyone on this call is from my great state, but that's okay. But I know a lot of folks are. Pennsylvania specifically, we have a high rate of firearms ownership. Over 800,000 guns were sold in Pennsylvania alone in 2024. A lot of folks are multi-firearm owners. So, it's not just that they own a rifle or a handgun, they've got lots of guns in their home. And 27% of people surveyed who are 65 and older, they report that they are one of those multi-firearm owners, and that 37% of folks identify that they live in a home with a firearm present, even if they themselves are not a firearm owner. Later, when we're talking about caregivers that are providing care in the home, maybe to a family member, that can be the case too. We have like multi-families and multi folks kind of coming together. Additionally, we're seeing close to 6,000 firearms stolen in PA every year. But what I do want to point out, a lot of folks don't realize this, is that there is no law in Pennsylvania that you have to report your firearm immediately if you notice that it's lost or stolen. So these are only those reported. So we anticipate, I think that this number is much, much higher. And we are seeing high rates of firearm deaths in Pennsylvania from suicides. And of those, almost half of them were over the age of 54. And when we start talking about folks with memory loss, we're going to start seeing why the risks are so high for them, and then why the risks are so high for people who are providing caregiving services, which, as I'm sure most people on this call know, are very intensive and often very difficult for a variety of reasons.
A little bit on this one, it's kind of the confluence of everything, is that we're seeing an uptick in the number of guns in circulation, right? Since COVID, we've seen an uptick in legal gun sales across the board. Right now, and I don't get political, I can't, based on my nonprofit status with Brady, with End Family Fire. But what we're finding is rollbacks, right? Rollbacks with the ATF, and there's a number of cuts. You're seeing the DEA, there's a number of cuts. We saw the White House Office of Gun Violence Prevention dismantled and no longer exist. We're seeing the ability for local sheriffs and police departments and other groups on the ground, community violence interrupters, we're seeing their funding gone. And so a lot of the safeguards in place have been rolled back. We're seeing more guns in circulation. And then we saw earlier the low number of who's storing their guns. So you have kind of the increased numbers of guns, more being stored insecurely. And then you're seeing also with, we just saw with 988, the suicide prevention crisis line, we saw that they just dismantled the press 3 option for LGBTQ. And so you're seeing other groups, there's upticks to the crisis lines right now. People feel threatened. They've lost their jobs, right? If you look at the factors for suicide, we're having unemployment, stressors, everything out there is coming together at a head. And then you're having this increase in guns. So like, this is the time where everyone has a role to play, and everyone, to make sure that your neighbors, your family, your friends, that these are simple steps. It all comes down to a simple call to action. Just keep your guns securely stored.
And so when we dig in on the caregiving itself, one of the things I really want to highlight is, of folks surveyed who are, having to rely on caregivers for either a portion of their care or for total care, like in the home, only 20% of them have a written plan for what they plan to do with their firearms. And that includes folks who are not yet in care, but are multi-gun owners. So this is the moment when I would really recommend too, if you are on this call, if you are a firearms owner and you do not have a plan, this is time to include your firearms in your estate planning and to really think about where they are going to end up. This is if you have folks in your family who are multi-gun owners who in a few years or right now may have a lot in the home. Start talking to them about what their plan is should something happen. When we dig into folks suffering from memory loss for a variety of reasons, we see over 60% of dementia patients have firearms at home. Half of those are stored loaded. An additional 38% of folks surveyed, and this is of caretakers of dementia patients, said they didn't know if the firearms in the home that of the person they're caring for were stored securely or not. Also, anecdotally, what we see a lot here is that sometimes folks will report that they think there's a gun in the house, or I will quote my own uncle on this, I think I have 5. And so, and maybe one of them hasn't been seen for quite a while. And so that is a really, really big concern. As Colleen has pointed out, the means really do matter when we're talking about suicide prevention, and firearm suicide has such a high fatality rate. It's 90%. When we get into caring for dementia patients in particular, we're seeing that 73% of all suicides of dementia patients are coming from firearms. There are a number of reasons for that. We can dig into it a little bit more, but the reality is that if you are caring for someone, especially right in that window where they are initially diagnosed, firearms in the home are an incredible risk to themselves. I really want to underscore when we're talking about this how grounded, when we're talking about studies and doing percentages and things, I think it can be really easy to forget the people behind them. There have been a number of very kind of high profile stories or things related. And this all comes from folks who, with cognitive decline, who are having a really hard time just dealing with firearms in the home. So in particular, we're dealing with folks who are forgetting, as in the first one from Tampa Bay Times, having issues with the loading and cleaning of their firearms. 20% of unintentional firearm discharges happen to those over 50. So that's, you're cleaning them. In this case, a gentleman who was a longtime law enforcement officer has probably cleaned that gun 1,000 times, if not more, in his life, and accidentally kind of fumbled, wasn't aware that he hadn't cleared the firearm, just completely forgot, was having kind of those 5-minute windows where of short-term memory loss, and thankfully did not, but almost killed his wife. And the second one for NPR, we're dealing with another wife who was caring for her husband, who forgot who she was, didn't recognize her, thought that she was an intruder, and thankfully, while he was looking for the gun, locked himself in a room, and his wife did not know where the gun in their home was stored. Could he get access to it? What could happen? And then the final story here from Seattle, where we're talking about, and these are just examples of what can go wrong, is that risks to themselves because the community perceives them as a risk. So this was an older gentleman who was going through a kind of a sundowning period. He was very, very nervous and concerned. So he was on his front porch waving a gun. Neighbors called 911 because they were concerned. When the police arrived, he didn't understand what was happening. And as a result, he fired on the officers, and then they fired back. And so these are all the things that can kind of go horrifically wrong with a firearm in the home that you don't have a plan for. And it can also then spill out, as we talked about at the very beginning of this presentation, to risk for other folks in the home too. Colleen?
And absolutely everything that JJ said, I can tell you from our End Family Fire campaign, we get these heartbreaking emails into our inbox
all the time.
And so, and I'd rather, there be a little discomfort with the conversation on the front end than a life of regret and, distress and just absolute, the awful fact that what these families are dealing with. So we can see some more numbers on this one. Again, it's just secure storage. I did see, and I'll kind of pivot for 1 second about the note about the Veterans Affairs and the veterans. We'll talk in a little bit, but a lot of times it's the messenger that carries the weight. And especially with the veteran community, it's veteran to veteran, right? They can talk the lingo, they can use the right acronyms, they can address it, whatever branch they're in, and things like that. And a lot of times we'll rely on veterans to carry that message saying, look, I lived with a gun for 30 years when I was in the service. I relied on it for my life, but I do know that I'm not living in that environment anymore. And here's what, and here's why I keep it safely stored. So we have a whole campaign, which I can share with you too. It's called Service Never Stops. But we can add that in. But some other known facts, 76% of school shooters get their guns from the home, right? They weren't safely stored. They use it. They brought it to school. We're seeing kids as young as 6 bring guns to school. And, again, like just keep it out of the reach, keep it locked away. We actually had a member of Brady staff years ago who came in and said, oh, my son doesn't read, only plays video games, so I'm just going to put it on the top shelf of the bookcase. Well, absolutely, the kid found it and thankfully was stopped by an older sibling. And so you just never know. That will never happen in my house. Doesn't apply because it could. 30 million kids across the country live in households with firearms. We know that. And then, especially when traveling, especially when a grandparent, especially visiting friends, family, neighbors, we have a campaign called Asking Saves Kids. And it's normalizing asking if there's a gun in the home, right? Because, we have in this first bullet here, if you're in cognitive decline, you may forget that the gun is out. Kids can stumble upon it, play around with it, not really understand it. So we're really starting to make sure if there is a gun in the home, no matter who is coming over, make sure it's securely stored. And then I mentioned earlier the 8 kids a day unintentionally find a gun. Unfortunately, we find this a lot in cars as well. A parent goes into either to pay for groceries, leaves the kids in the car, or, to gas station, goes in for just a minute, and kids are playing around in the car and they find the gun and it wasn't, safely stored. It was just left between the seats. And then this is the frightening part, you ask, and we do a lot of focus groups for End Family Fire too. So I sit on a lot of those, like JJ said, I sit on a lot of those videos. And we had one guy that had 11 guns in the home and could only find 8. And on camera, we were watching him look through his house and say like, well, I really don't know what happened with those others, and kind of joking it off. We're like, that's very frightening. You don't know who has them or where they're being stored right now. And so we know a lot of the parents, when we ask them, they're like, my kid has no idea. Then you ask the child and they're like, here's the passcode, here's the gun.
Yep.
So it's nearly 1 in 4 children have actually handled the gun in their home and their parents never knew about it.
And then this increases risk as well to everyone else in the home too, because when to circle back to that, where we don't know where everything is, or there's someone going through cognitive decline, especially if they're, if it's known in the community that there are guns in the home that are unsecured, that are easily accessible, it then opens you up to be the victim of having that gun being taken away, and then realize by someone for nefarious purposes, and then realizing that your firearm contributed to causing harm, which I can't think of anyone would be happy about. Then when we're talking about the caregivers themselves, a lot of the folks on this call who are providing so much support emotionally, physically, mentally, oftentimes financially, and this can be really, really hard on folks. It can increase stress, depression, anxiety. Caregiver burnout is real and a major issue. I know Community and Family Builders has talked a lot about this in previous efforts that they've had. But when we're talking about folks who are caregivers, and these are folks that are even providing kinship care or elsewhere, we're seeing really high rates of depression symptoms. A study from 2021 came back that 40% of caregivers reported that they had passive thoughts of suicide, and 30% had serious thoughts of suicide where they had actually begun kind of internally like making a plan, which is a very big concern for us. And so if you yourself are living then in a home with a firearm, all of those firearm risks for suicide that we talked about at the beginning of this call, for folks with memory loss, this could then also apply to you, right? This can happen to anyone. And so we really want to make sure that we have that time and separation that secure storage can provide. Colleen has kind of mentioned and gone into what End Family Fire is, but there's a particular PSA that we thought would be helpful to play for you all, so you could just kind of get a sense of all of the different kind of forms of risk you have when you bring a gun into your home that is not secured. Colleen, anything else you want to share for that before I share the PSA?
Yeah, I just want to talk End Family Fire, just the term itself. Family fire is a shooting that results from someone having access to a gun they shouldn't have had. So that could be an unintentional injury, the kids getting a hold of it, a suicide, or kind of the 76% of the school shootings. So that's a term you'll hear us use. It was a play, we did a lot of testing on it. It was a play off the term friendly fire, and family is just, it's kind of taken that, but saying protect your home. A little bit about,
And as
yeah,
oh
and
yeah,
this
go
is,
ahead, Colleen.
I think I've mentioned a lot of this. This is just one of the things that differentiates this campaign from others is we actually bring gun owners into the conversation from day one, right? So we don't develop a campaign and then this is what you need to know. It doesn't get political at all because we partner with Ad Council. It doesn't get partisan. We take the stance that we're not asking, we don't care if you have a gun in the home, but if you do, keep it safely stored and out of the reach of someone who shouldn't have access to it. We talk about unintentional suicides and then intentional shootings. And again, the CTA, the call to action, is pretty easy. It's just keep your gun securely stored. The other thing you'll hear us probably say is secure more than safe. One of the things we've realized, safe storage has a designation in some of the gun owners' terms that, oh, I already know safe. I put my mental block down. I'm not going to listen to you, right? Because I already know what safe is. I'm a gun owner. You're not. So we say secure, and we've done a lot more testing on that. So you'll hear us kind of shift that terminology.
So I'm going to go ahead and play our PSA really briefly now. Again, warning, there are some depictions of violence and firearms. So if that's a concern for you, please feel free to minimize and pop back in. It's 60 seconds.
I know my gun should be stored locked and unloaded. But what good is a gun if it's not prepared for use? So instead, I'm prepared for misuse. I'm prepared to stop arterial bleeding in 3 minutes. Less for kids, they bleed out faster. My son just shot himself. Hurry. Access to firearms triples your risk of death by suicide. But that's not the only way to misuse a gun.
I think I've heard Mama.
Misuse can happen when you least expect. So being prepared means knowing the difference between CPR for adults and kids. Unintentional shootings happen every day.
There's been another deadly shooting in a local elementary
So that sense of safety my guns bring me
school. The gun he acquired from the family member's home.
can shatter in an instant.
The developing story will bring you more updates as they happen. Firearms.
Store your gun securely, locked, unloaded, and away from ammo.
Anything, Colleen, you wanted to add before we move on?
I know.
No, we usually just take a little beat
Yeah.
because that is probably our heaviest public service announcement. And we had some debate when we were to push that out and said, is this too heavy? Is it too dark? And the conversation is the issue is that, right? The issue is a heavy one, and we wanna hit this head on. So I know sometimes after we show it, we let everyone just kind of sit for a second before we continue on. So we can again, call to action is pretty simple, but we have a couple of other things that we can do. If we want to go to the next slide.
Yeah.
These are, and many of you have seen this, but there's a lot of great resources out there. Our website right now, End Family Fire, will launch a brand new version in September with a lot more interactivity where you get to kind of see these in action. But there's a lot of ways that you can safely store your gun. There's the cable locks, right? The trigger and the cable locks. And many of you have seen these. The VA gives them away. These are the ones that the VA gives away. We've started making tags, right, with End Family Fire on them. Cable and trigger locks, the preferred method a lot of times is safes and cabinets, right? And you're seeing now the DoD is actually changing their standards. When they would move somebody from location to location, they had a pretty low standard for what they could transport, and sometimes the gun safes were too heavy. And so they actually went back and they changed some of the guidelines to ensure that no matter if you're changing your location, you'll still be able to carry your gun safe to make sure that your family is safe. Lock boxes, carrying cases, especially in cars. They do make console locks that you can keep your guns in, and then offsite storage. So a lot of gun clubs, a lot of ranges, police departments in some locations. Some of the states have a safe storage map. And I know Colorado, New Hampshire, and some of the other states do. So, you usually call your local authorities to figure out if you want to remove it from the home. But there's a lot of options, and a lot of times the concern about if someone's intruding from the outside into my home, they're gonna, I want it for protection. The biometric things that they're introducing now are pretty quick. There's a grant given by the VA where they had an app on your phone. And so, if you were going to be out and, maybe you were going for drinks and you shouldn't have access to your gun, you could actually lock it via your phone for a certain amount of hours, right? Or if you had some crisis and you knew it was a difficult time, a tier level 2, someone would have to unlock it for you to make sure that, you wouldn't be able to access that holster that was bolted to the table. And then there's a whole other, and I know JJ has a lot of these too from the podcast, is almost like in a jewelry store, it's weighted. So if it moves, there's a bell or there's something on your app where you get a notification, even if you're traveling. So there's a lot of methods, not just like one cable lock or one box. It's really kind of user whatever you feel most comfortable with, there is an option for you. And then the next slide, I think.
And then I'm really glad Colleen mentioned some of those things and some options. So I'm going to start at kind of as Colleen just presented, those are some of the ones for kind of in the home. And now we're going to talk that you can have in the home. I will make one little comment before we move on to kind of how to permanently or temporarily remove firearms from the home, with two caveats. One, this focuses in many ways on Pennsylvania. So I just want to make sure that folks are aware. Rules are kind of different in different places. And then the second point I want to make is that oftentimes one of the questions I will get or I will see is, can't we just remove all of the ammo from the home, all of the bullets from the home, and then the guns are still present? Unfortunately, no. Ammo is very easy to get access to. There have been a number of cases where families have done that as a precautionary measure, where they've removed the ammo but left the firearms, and folks have been able to get a hold of ammo, or they find an old box in the back of their closet, or they find a bullet, right, that they've held on to. And so we really want to make sure that when we are, ideally, that everything is stored locked, unloaded, and separate from ammunition. I'm not saying you can't remove the ammunition in addition to that if you're going for a permanent or temporary removal. I think that's a brilliant idea. I'm just saying that that's not the solution. I just want to make that clear. So let's say that I am a caretaker, or I am someone who is starting to experience a memory decline, and I want to make sure that I'm getting the firearms out of my home. You have a couple of different options. One, you can sell them. You can take them to a licensed firearm dealer, which we will call an FFL, and sell them, get rid of them. You also can surrender them to a local police station. The procedures are different from county to county, but normally, sometimes they want you to bring it to the station, sometimes they'll come collect it. But if you call your local non-emergency line, they should be able to connect you to someone in Pennsylvania who's able to assist you with that. There are also a number of national organizations that if you just look up gun relinquishment, that will provide you with how to do it. There are some that turn them into art projects. There are some that give gift cards in exchange. There are some that just pick them up. So you can really find what suits you best. You also can, if you feel the need, move into kind of some other permanent options. The first one, at the bottom of the list that I think is probably easiest in Pennsylvania, is transferring the firearms to a trusted person. So in Pennsylvania, we allow for kinship transfer. So for a very nominal fee, you can transfer, say, your firearms to your son or your daughter. You can transfer them to your brother. For a slightly higher regular fee, you can transfer them to your best friend, or a lot of times with veterans, we'll say, do you have a battle buddy that you trust that is doing well, that can hold on to them for a time? They will have to pass a background check, and it will go through an FFL, but you can allow them to take possession of the firearms, which will, if you are, this is why I say the estate planning part is really helpful, because sometimes I think it's a much easier, as someone whose mother was a caregiver to my grandfather who had dementia, it was much easier to get him to surrender the car when he was giving it to one of the grandchildren to use, and we filled out that paperwork, than it was to say we're taking the car away, right? So you can pursue that, and then once the guns are out of the home, maybe you pursue other options there to make sure they're securely stored. You can also seek a protection from abuse order. So that is if this person is starting to, threaten harm to themselves or others in the home. Unfortunately, one of the things that does happen sometimes is if you have different home health aides or folks coming out, if you have to call EMTs often, there's people in the home often at night that they don't know and they're scared. So you can pursue to have that removed. That is through law enforcement. And so that involves law enforcement, and then a Section 302, which involves a medical professional, which is again a concern for themselves and others. And then so not only is the firearm removed, but their ability to purchase more. I'm happy to talk more about that. There's also a number of Pennsylvania specific groups like Ceasefire PA that have a lot of information on their website. I'm happy to share. But I just want to be really clear that I think sometimes the most palatable one is that transfer, or that selling, moving it on, especially if folks are, hey, I spent a lot of money on these. I spent a long time collecting these. This is a legacy item. I got this from my grandfather. I don't want to sell it. Well, do we have someone who will store it securely that you can transfer it to, and then it's not gone forever? For temporary removal, you can seek offsite storage. So any licensed federal firearm dealer, so that FFL, a lot of shooting ranges, and any law enforcement group in Pennsylvania should provide you with offsite storage. So again, call that non-emergency line, and they should walk you through how to do it. For the retailers and the law enforcement, their procedures may differ. Again, can you bring them in yourself? Can they come collect them? But what happens with that is they give you a detailed receipt of all the firearms you've surrendered, and they're there until you go pick them up again, at which time you have to pass that background check again. If you're dealing again with somebody who is having some cognitive decline, that is something you get it out of the house and then you can redirect, right? We'll go pick them up. We can go pick them up tomorrow. We can go deal with it tomorrow. And again, this is something that I really position. Most firearms owners bring their guns into their home because they want to be a protector. It's something that makes them feel safe. It's something that they brought in because they want to make their family safe, their community safe. They're worried about it leaving. And when you're suffering from cognitive decline, it's very common to be scared. It's very common to be angry because you're scared. It's very common to be frustrated. So presenting this as the safe thing that you can do for your family, this is a proactive step that you can do, I think is very, very helpful. There's also an additional step you can take that is not right now currently legally available in Pennsylvania, but we wanted to make folks aware of it. I know there are some folks on the call from California. You have a great one. Colleen, do you want to share a little bit more about what we call ERPOs?
Yeah, so these are extreme risk protection orders, but they also go by, so California is GVRO, gun violence restraining orders. There's also LVRO, there's also FRO in Illinois, which we'll talk about, firearm restraining orders. So it's not a universal term. Sometimes you'll hear this referred to as red flag laws, and it's just a mechanism, that allows, if you're concerned about someone and someone is in danger of harming themselves or other, it's a legal way to intercede and get that gun removed from the home. So a petitioner is someone that starts that process. Each state has different regulations on who it can be. Some, like in Illinois, which we'll talk about, it can only be a family member living in that home or law enforcement. Other areas, it can be school, it can be a therapist. So it really varies state to state. But it's a way that you can be assured, and a lot of times we'll hear this is punitive, like you're coming after, this is a gun grab, you're coming for my gun, and it's furthest from the truth. This is, when we were doing testing on this, we changed one word. We said, this is not against you, this is for you. This is for you to save your life. And what an ERPO does, it allows you to that time to heal, to get help, and to take a pause. But it also allows on the back end, once you have that time to heal, there is a mechanism and a legal process for you to get those guns back. So, if it was just a moment of crisis, you're like, I just needed a minute, I got some help, I really want my guns back. There is a process to get your guns back. So it's temporary removal, could be permanent, you just never know. But there is a judge, there's paperwork, and as some of you on here know very well, that's a process. So the next slide, I know we'll talk a little bit about, and you can keep. It's kind of exciting to talk about today. Today is Wednesday. Next Tuesday, so less than a week from now, we are going to launch the second variation of this. But what happened is, through the federal dollars that were coming down through something called burn skip funding, and that was going to the states for, gun violence prevention, suicide prevention, and what they realized though is, as this money is coming down, do we really know what's most effective? Like, what messaging would work? Where is their gap? And so Ad Council, along with the Joyce Foundation, did some research, and they spent about a year pulling together like an analysis, and where is that gap? And what they found out is that in those states with ERPOs, or extreme risk laws, red flag laws, there was such low level of awareness of that this was a resource that they could tap into. I think it was less than 10%. It was like 9 to 10% of those individuals in those states, in Illinois, knew that this existed. And so that's what we realized. We said, we're going to lean in a little bit on public awareness. So we partnered with the Ad Council, and we partnered with the Illinois Department of Public Health. And, we pushed out, and this is a link here as well, but it's really centers that individual in crisis and their support team around them, their caregivers, to notice if you see signs of someone in distress. Don't stigmatize them, don't focus on the mental health part, just focus on the gun part, and say like, hey, you have access to a gun. We already saw the stats on what that looks like. It's I'm going to protect you. I'm going to be here for you. You just need you need a pause. You need time to heal. And then you can, we can start the process if you need to. So, we pulled everyone together. We launched this PSA. We termed the entire campaign Pause to Heal. We realized the end user, there was more trust in a government entity. So this lives on illinois.gov/pause to heal. If you go to that website, it links you right to, here's what the law is for firearm restraining orders. Here's how to, enact it, or here's where you need to go. Here's who you need to contact, and a little bit more information about that. So on Tuesday, what we're going to do is we're going to launch 3 new public service announcements and 3 60-second spots, 3 30-second spots, along with the press release. There's radio spots and digital ads, and all of that will go out. We've been on tour all week, so I've been on a lot of Zooms with the legislators from across the state, cabinet officials. Last time we had the governor and the lieutenant governor. So this is an all hands on deck from the entire state, from top down, bottom up, really kind of making sure that this is pushed out.
And so we wanted to, and I'll make sure that you get a link to it so you can watch, but one of the things that we really wanted to make sure that as we closed out and went into the Q&A section, that you knew that that is actually also too part of a call to action that you can be engaged in. And if this is something you're concerned about, that you can be looking into what are your local and federal laws around this, and then how to get something like we have going in Illinois spread and shared. But we really wanted to break down really quickly some suggestions we have for caretakers to have the conversation, not just with the person you're caring for, but for the other caretakers that you see in peer support, right? Y'all know each other better than anyone else because you're going through the same thing. You're talking with one another. And so you can kind of start to see when someone is in distress, and if there's, oftentimes what's going on in the home. So Colleen, I don't know if you want to break down how to have the conversation or.
Yeah, and I know some of the questions have coming up in the chat as well, but it's casualty. You don't get kind of finger pointing, you have a gun, you have a gun, and this is terrible. It's more of a, hey, I'm concerned about you. There are risks of the gun in the home. We were just talking today to NAMI, the National Association for Mental Illness. And one of their, questions was too, is engaging family members in the conversation. Don't just make it me on you so they feel attacked. Just have a conversation, and express your concern about the gun in the home and the danger that it provides. And it's no different that you would talk about like fire safety, right? If someone, has with matches or leaving the gas on the stove and things like that. It's just like you have every other conversation about safety in the house. And then, really explain the conversation in more detail so they understand it. And, if it takes a messenger, like we said, if the person is a little resistant, bring in, a neighbor that maybe is a veteran, right? Or does have a gun that can convey that message and said, I have a gun at home. Here's why I keep it safely secured. We also have PSAs from veterans that we can send to you, right? And you can have them watch it if they want to and kind of hear from perspective. If you really run into a snag, like you can reach out to us and we can have, we can put you in contact with individuals who are willing to help have that conversation with the individuals who are kind of resistant as well. And then, like let them know. I know the one thing about I need the gun really quickly. We can actually provide some videos to you, of all shows. Fox and Friends last summer invited us up to go with a veteran from our Service Never Stops campaign and sat us down. And what he did is he pulled kind of a biometric safe and showed them it takes literally just like a second or two to open it up. It opens up, you have access to your gun, right and ready. So, time should not be a concern. If you don't feel comfortable carrying that message, we have resources for you. We can point you in the right direction. You can show videos. A lot of gun shops we're actually talking to now about, putting this information at point of sale. We had one of our veterans go out and speak in gun shops from his perspective. What happened? The result was a lot more people bought safes, right? So the gun shop is happy. We are happy because more people are buying safes and safely storing their guns. So this, we can do a collaborative effort. We worked with the North Carolina Police Department. Same thing. We worked with them on, as long as you're storing your guns safely, securely, the community is much more safe. And then, share with them these different options. And, it's not just one, like you saw, it's not, some people hate the trigger, like the ones that the VA gives out. I can tell you a lot of gun owners hate these. And so, if cost is a concern, in some cases we've reached out and got a sponsor to help sponsor a number of safes that you can give away in a community and things like that. So there's a lot of options. We can be creative, and we're here to help. And then have them look around. We're working. We can talk a little bit too, maybe offline, but we have a whole show gun safety campaign. We're working with major studios and television shows and movies to kind of depict secure storage and what that looks like, right? So start normalizing that from the visual end and what they're seeing in campaigns. Have the conversation, and slowly but surely it'll get kind of sticky where we'll be able to change the narrative.
And I will just add again, as someone who's kind of gone through this both professionally and personally, I think everyone knows the people in their life best, right? You know how to frame it. But as Colleen said, keep the conversation casual. But I think always, if this is somebody who wants it to be funny and lots of jokes and going, or a real serious conversation, the pain points too, that, I don't feel safe with the grandkids coming over. I don't feel safe, having Meals on Wheels come by. If, you have this, what matters to folks and how to frame these conversations best, but please reach out if you need help kind of even drafting that. I personally have a lot of success with, are they, as Colleen said, do they have a battle buddy? Do they have a best friend that they trust? Do they have a faith leader that they trust that you're willing to bring in? Are they a member of an organization like the Masons or the Lions, where there may be folks there that they really kind of respect and believe in? And we're always happy to provide that information. An additional one too, we do know that only about 20% of caregivers are spoken to about safe storage and gun safety by their medical professionals. We are working on changing that, but please feel free to be empowered both for yourself. I really want to keep stressing that, both for yourself, because as a caregiver, you're under immense stress, and for the person you're caring for. Ask your doctor. And if they don't have resources, we have This Is Our Lane, which has a variety of resources. But if they don't, reach out, as Colleen said, to me or Colleen, we can share them, but they should be able to connect you. The groups like the Alzheimer's Association and the Society on Aging also should have resources available for you to help kind of steer that conversation. But the important thing is that if this doesn't work, if the first conversation goes poorly, don't give up. Have it again. If you have to have this a whole bunch of times, it's fine. It's better, and I'm sure if you've had this conversation maybe about car keys or medication or things like that, it is better, as Colleen said at the beginning of this call, with one of the really tragic examples that unfortunately she and I get every day. A moment or a week or two of discomfort, or someone you love kind of getting a little huffy with you, is worth it. If it saves their life, if it saves your life, if it saves the life of somebody else that you love and people in your community. So I just really want you to feel empowered that you can sit in that discomfort. It's okay. It's worth it. And then right before we go to Q&A, wanted to make sure that this will go around. We'll send a little link with all of these things, but how, links to how to find all of our PSAs, all of our information, and how to find our medical work. Colleen, anything else before we open into Q&A?
No, I think